If you're over 70 and you've started feeling dizzy, unsteady, or slightly off balance, there's something important you need to understand. It isn't always just getting older. In fact, dizziness is one of the most misunderstood symptoms in older adults. Many seniors assume it's simply a normal part of aging. They tell themselves, "I'm getting older, so of course I'm a little unsteady." But that is not always true. While aging does change the body, persistent dizziness is often a sign that something else deserves attention. And understanding what is happening inside your body may help you prevent one of the biggest threats to independence after 70 falls. Every year, more than 14 million older Americans fall. That is roughly 1 in 4 adults over the age of 65. Some recover quickly, others suffer broken hips, head injuries, or long hospital stays. And falls are now the leading cause of injury death in this age group, with rates that have climbed sharply over the past decade. Surprisingly, many of those falls begin with something that seems harmless, a brief moment of dizziness, a slight loss of balance, or a feeling that the room shifted for just a second. Today, I want to explain why that happens, not to frighten you, but to help you understand what your body may be trying to tell you. Because once you understand the most common causes of dizziness after 70, you will know why it happens, what symptoms deserve attention, and when it is time to speak with your healthcare provider. Let's begin with one of the biggest changes that happens as we age. Our balance system becomes more complex. Most people think balance comes from the legs. It does not. Balance is actually the result of several different body systems working together at exactly the same time. Your eyes tell your brain where you are. Your inner ears detect movement and changes in position. Tiny sensors in your muscles and joints constantly report where every part of your body is located. Your brain gathers all of that information in a fraction of a second, then tells your muscles exactly how to respond. All of this happens so quickly that you never notice it, until something changes. After 70, each part of that system naturally becomes a little less efficient. Vision may not be as sharp. The inner ear becomes less sensitive. Reaction times slow slightly. Muscle strength gradually declines. The nerve pathways that connect these systems also carry a slightly fainter signal than they once did. The brain still performs the same remarkable job, but it has slightly less information to work with. Imagine trying to solve a puzzle with several missing pieces. You can still finish it, it just takes more effort. The same thing happens with balance, and the extra effort it costs is one of the reasons unsteadiness creeps in so gradually that many people do not notice it at first. Now, let's talk about the symptom itself. Many people use the word dizzy to describe several completely different sensations. Some mean the room feels like it's spinning, others feel lightheaded, some feel weak, others simply feel unsteady while walking. These are not necessarily the same problem, and that is why doctors ask detailed questions. The type of dizziness often provides important clues. For example, if the room feels like it is spinning, the inner ear may be involved. If you feel faint when standing up, blood pressure may be involved. If you feel unsteady while walking but not while sitting, muscle weakness or nerve problems may be contributing. If you feel as though you might tip over when you turn your head quickly, that is another cue entirely. The body is giving information. The challenge is learning how to interpret it. Many seniors describe their symptom in just one word, dizzy, and stop there. The more precisely you can describe what you feel, the more quickly a clinician can narrow down the cause. One of the most common reasons seniors feel dizzy is surprisingly simple: standing up too quickly. When you are younger, your body adjusts almost instantly. As soon as you stand, blood vessels tighten. Your heart responds. Blood flow to the brain stays remarkably stable. After 70, those adjustments often take a little longer. Gravity pulls blood toward the legs. For a few seconds, less blood reaches the brain. The result is a brief feeling of lightheadedness. Sometimes your vision darkens slightly. Sometimes you feel like you need to grab a chair or wall. Doctors call this orthostatic hypotension, and research suggests it affects roughly 1 in 5 community-dwelling older adults. Blood pressure can drop measurably within the first 3 minutes of standing, and the symptoms can appear even sooner. Usually the sensation lasts only a few seconds, but those few seconds can be dangerous, because that is when many falls happen, often right at the bedroom doorway or the side of the bed. A simple home check you can try. After lying down for 5 minutes, stand up and stand still while counting slowly to 30. If you notice lightheadedness, dimming vision, or a swaying sensation during that count, your body is telling you something that deserves attention. Now, let's talk about blood pressure itself. Many seniors take medication to lower high blood pressure. These medications save lives. They reduce the risk of heart attack. They reduce the risk of stroke. They protect the kidneys and blood vessels. But sometimes blood pressure becomes a little too low, especially when standing, during hot weather, or after dehydration. The medication has not suddenly become harmful. The body's circumstances have changed. And that is an important lesson. The body is not exactly the same every day. Hydration changes, illness changes, temperature changes, activity changes. Even the timing of a meal can shift how blood pressure behaves. A dose that felt ideal in winter may feel a little excessive in summer, when the body is already losing fluid through perspiration. If you have ever felt lightheaded during a heat wave and wondered whether your medication was suddenly too strong, the answer is usually no. The medicine has not changed. Your fluid balance has. Now, here is another reason dizziness becomes more common after 70. Dehydration. Many older adults simply do not feel thirsty as often as they did when they were younger. The body's thirst mechanism gradually becomes less sensitive. That means some seniors become dehydrated without realizing it, walking through their day with less fluid in their system than they would have noticed immediately at age 40. Even mild dehydration reduces blood volume. When blood volume falls, blood pressure may drop. The heart has to work harder to maintain circulation. The brain may briefly receive less blood flow during position changes. That is when dizziness appears. Hot weather makes the problem worse. So do vomiting, diarrhea, fever, or simply forgetting to drink enough water throughout the day. What surprises many people is how little dehydration is required before symptoms begin. You do not have to become severely dehydrated to feel the effects. Even modest fluid loss can make some older adults feel weak, lightheaded, or simply off. The amount that produces symptoms is often smaller than people expect. Now, here is something many seniors never expect. The ears play a major role in balance. Deep inside each ear are tiny structures filled with fluid. These structures constantly detect movement. They tell the brain whether you are turning, bending, standing, or walking. Sometimes tiny calcium crystals inside the inner ear move out of place. When that happens, brief episodes of spinning dizziness can occur, often triggered by rolling over in bed, looking up at a high shelf, or bending down to tie a shoe. This condition is called benign paroxysmal positional vertigo, or BPPV, and it becomes increasingly common with age. Research from geriatric clinics suggests that nearly 40% of people over 70 who experience dizziness have BPPV as the underlying cause, though it often goes unrecognized because the episodes are brief. The good news is that BPPV is usually treatable, often with a simple head position maneuver performed in a clinic that can resolve the spinning within minutes or days. But many people never realize what's causing their symptoms. Instead, they assume they are simply becoming frail. They are not. Their balance system is sending a very specific signal, and the signal is treatable. And that is just one example of why dizziness should never be ignored without understanding its cause. The body usually has a reason. The question is learning what that reason might be. Now, surprisingly, some of the most common causes have nothing to do with the ears or blood pressure at all. Let's talk about something that surprises many seniors. Sometimes the problem is not your balance at all. It is your muscles. Most people think of muscles as the parts of the body that help us lift groceries, climb stairs, or stand up from a chair. But muscles do something equally important every second you are on your feet. They help keep you upright. Every time you take a step, hundreds of muscles make tiny adjustments that you never notice. The muscles in your feet shift your weight. Your calves stabilize your ankles. Your thighs support your knees. Your hips keep your body centered. Even the muscles in your abdomen and back are constantly working to keep you balanced. When those muscles become weaker with age, your body has to work much harder just to stay steady. Sarcopenia, the medical term for age-related muscle loss, can take away several percent of muscle mass per decade after 60, and the rate often accelerates after 70. This usually does not happen overnight. It develops slowly. One year, you notice stairs feel a little harder. The next year, you start using the handrail more often. Then you begin avoiding uneven sidewalks because they make you nervous. Eventually, you realize your confidence is not what it used to be. Many people assume this is simply an unavoidable part of getting older. But muscle loss is only part of the story. Strength can often be improved at almost any age, and improving strength usually improves balance as well, sometimes within weeks when the work is consistent. A simple test. Try standing up from a sturdy chair without using your arms. If you have to rock forward, push off with your hands, or feel as though your thighs are not quite strong enough to lift you smoothly, that is a meaningful signal that the muscles supporting your balance could use some attention. Now, let's talk about another system that rarely gets any attention: your nerves. Tiny nerves in your feet constantly send information to your brain. They tell you whether you are standing on carpet, grass, concrete, or a slippery floor. They report exactly where your feet are at every moment. As we age, those signals sometimes become weaker. Conditions like diabetes can make this even more noticeable. But even without disease, the nerve endings in the feet lose some of their sensitivity over time. Instead of receiving clear information, the brain receives incomplete information. Imagine trying to walk across a room while wearing thick winter boots that dull every sensation beneath your feet. You can still walk, but you will probably feel less steady. That is very similar to what happens when nerve function declines. Some seniors describe it as feeling like they are walking on cotton. Others say the ground feels different than it used to. Some notice numbness or tingling. Others do not notice any change at all until they begin losing confidence while walking. These subtle changes deserve attention because they are often gradual, and gradual problems are easy to ignore, especially when life is busy and the sensation is more annoying than alarming. Now, let's talk about vision. Most people do not realize how much they depend on their eyes for balance. Try standing on one foot. It is challenging. Now imagine doing it with your eyes closed. Suddenly, it becomes much harder. That is because your eyes provide constant information about your surroundings. They tell your brain where the floor is, how far away objects are, whether the ground is level, and whether something is moving around you. Visual cues account for an estimated half or more of the postural control most people rely on without realizing it. Cataracts, macular degeneration, glaucoma, and even needing a stronger pair of glasses can affect how steady you feel. Bifocals and progressive lenses, while useful for everyday tasks, can briefly distort depth perception at your feet when you look down, and that distortion alone is enough to make some seniors stumble on a step they could once walk down with their eyes closed. This is one reason regular eye examinations remain so important after 70. Better vision does not just help you read, it helps keep you on your feet. Now, here is another factor that many people overlook: medication. Many common medications can contribute to dizziness or unsteadiness, including blood pressure medications, sleep medications, certain allergy medications, some anxiety medications, and some antidepressants. The more medications someone takes, the higher the combined risk becomes, a phenomenon clinicians sometimes describe as the burden of polypharmacy. Even medications taken safely for years can begin affecting the body differently as we get older. Why? Because aging changes how medications are processed. Kidney function gradually changes. Liver function changes. Body composition changes. A dose that felt perfectly normal 10 years ago may have a stronger effect today. That is why it is important to review medications regularly with your healthcare provider. Not because medications are bad, but because the body changes, and treatment sometimes needs to change with it. A pharmacist can be an excellent partner in this review because they can see the full list at a glance and flag interactions that busy prescribers sometimes miss. If you have found yourself more unsteady than you used to be, and you started a new medication recently, that is a conversation worth having, even if the medication itself is not new. Aging is a moving target, and the right dose 10 years ago may not be the right dose today. Now, let's talk about one of the most overlooked causes of dizziness after 70, low blood sugar. Even people who do not have diabetes can occasionally experience drops in blood sugar. Skipping meals, eating very little during illness, taking certain medications, and long periods without food can all leave the brain with less fuel than it needs. The result can be shakiness, weakness, sweating, difficulty concentrating, or dizziness. The brain depends on a steady supply of glucose to function normally. When that supply drops, symptoms often appear quickly, and they rarely wait for a convenient moment. A long gap between meals on a hot afternoon is one of the most common quiet triggers of lightheadedness in older adults, especially during travel, illness, or busy days when lunch keeps getting pushed back. Now, let's discuss another surprisingly common issue: poor sleep. Many seniors do not sleep as deeply as they once did. They wake several times during the night. Some have sleep apnea, where breathing repeatedly pauses without the person fully waking. Others struggle with insomnia, lying awake for long stretches in the small hours. When the brain does not receive enough restorative sleep, reaction time slows, attention declines, and balance becomes less reliable. Researchers have repeatedly found that long periods without sleep can impair coordination in ways that resemble the effects of mild alcohol intoxication. Performance on balance and reaction tests after a sleepless night can appear surprisingly similar to performance at or near the legal driving limit for alcohol. That is remarkable. It reminds us that balance depends on much more than our legs. It depends on the brain functioning at its best, and the brain depends on quality rest. Now, let's talk about fear, because fear itself can affect balance. Imagine someone who has already experienced one fall. The next time they walk outside, they are more cautious. Their muscles become tense. Their steps become shorter. They look down constantly. Ironically, that fear often makes balance worse. Tensed muscles react more slowly than relaxed ones. Shorter steps give the body's adjustments less time to correct small errors. This creates a cycle. A person feels unsteady. They become afraid of falling. Because they are afraid, they move less. As they move less, muscles become weaker. As muscles become weaker, balance declines further. As balance declines, fear grows. The cycle continues, and it can quietly shrink someone's world over the course of months. A favorite walk dropped, a beloved hobby set aside, a grandchild's house visited less often, all because the person has begun to lose confidence in their own feet. Breaking that cycle is incredibly important, because confidence plays a much larger role in mobility than most people realize. Walking with quiet, steady attention is not the same as walking with tense, frozen caution, and the difference between them is often the difference between staying upright and taking a tumble. Finally, let's discuss one of the most important lessons of all. The body rarely sends just one warning sign. Instead, it sends patterns. Maybe you have become slightly slower getting out of a chair. Maybe you are reaching for furniture while walking. Maybe you have stopped taking evening walks because you do not feel as steady. Maybe family members have noticed changes before you have. These small clues matter because they often appear months before a serious fall occurs. Listening to them early is one of the most powerful things a senior can do for long-term independence. The good news is that balance problems are not simply something you have to accept. Many of the most common causes can be identified, and many can be improved. The key is recognizing them early. Now, let's talk about the question every senior eventually asks: what can I actually do about it? The good news is that many of the causes of dizziness and unsteadiness after 70 can be improved. Not overnight, not with a miracle cure, but through small, consistent habits that help your body work the way it is designed to. The first habit is hydration with intention. Aim to drink water steadily through the day rather than in large amounts all at once. Keep a glass or bottle within reach, and sip at every meal and between meals. In hot weather, during illness, or after any activity that causes sweating, increase the amount. If your healthcare provider has asked you to limit fluids for another reason, follow that guidance, but ask whether the limit can be adjusted during heat waves or periods of illness when the body's demands change. The second habit is moving through position changes slowly. When you stand up from bed in the morning, sit on the edge for a few breaths first. When you rise from a chair, push up with your hands and pause before walking. The few seconds you spend pausing are often the seconds that prevent a fall, particularly the first one of the day, when blood pressure has been low for hours and the cardiovascular system is just beginning to ramp back up. The third habit is strength work that does not feel like exercise. Standing up from a chair without using your arms, 10 slow repetitions twice a day, builds the very muscles that keep you upright. Calf raises while holding the kitchen counter, heel to toe walking down a hallway, gentle side leg lifts. All of these are simple, low-risk ways to rebuild the support system your body depends on. Done most days of the week, they add up to measurable improvement within a couple of months. The fourth habit is balance training in short, frequent doses. Standing on one foot while brushing your teeth, holding the counter for safety, is a legitimate, evidence-supported balance exercise. Standing heel to toe in a doorway for 30 seconds trains the inner ear and the ankles together. A few minutes a day, done regularly, produces measurable improvement within weeks. The trick is consistency, not intensity. The fifth habit is having your vision and hearing checked on schedule. Updated glasses, clean lenses, and well-managed hearing all reduce the load on the balance system. Hearing matters as much as vision here, because the inner ear shares its job with the auditory system, and untreated hearing loss has been linked in multiple studies to a higher risk of falling. A hearing check belongs on the same calendar page as an eye check. The sixth habit is reviewing your medications with your clinician at least once a year, or anytime a new medication is added. Bring the full list, including over-the-counter products and supplements. Ask whether any of them increase dizziness, lower blood pressure, or interact with one another in ways that affect balance. The goal is not to remove medications you need. The goal is to keep your regimen matched to the body you have today. The seventh habit is sleeping with the brain in mind. Keep a regular bedtime and wake time. Limit screens in the hour before sleep. Talk to your doctor if you snore loudly, wake gasping, or feel unrefreshed even after a full night in bed, because sleep apnea is common, treatable, and one of the silent contributors to falls. The eighth habit is eating on a steady rhythm. Skipping meals is much more dangerous after 70 than it was at 50. The brain's fuel supply is thinner, and the recovery from a dip is slower. Regular meals with a small amount of protein at each one keep the system more stable through the day. A handful of nuts between breakfast and lunch can quietly prevent an afternoon wobble that would otherwise catch you off guard. The ninth habit is making the home environment an ally. Remove loose rugs, secure cords, add lighting to hallways and bathrooms, install grab bars where they help most, and wear shoes with non-slip soles indoors rather than going barefoot or relying on socks alone. Most falls happen in places that feel safe, precisely because people stop paying attention there. The bedroom, the bathroom, the front steps, and the kitchen at night are the usual sites, and each of them can be improved with a few small, intentional changes. The 10th habit, and perhaps the most important, is speaking up. If you have fallen, even once, if you feel unsteady, even occasionally, if a family member has expressed concern, tell your healthcare provider. The information you bring to that conversation may be the single most important piece of the puzzle, because what you describe in your own words often points directly toward the cause. Many seniors quietly absorb a fall as if it were a personal failure. It is not. It is a piece of data. Bring it forward. And a final thought worth keeping close. The goal here is not to become a different person at 70. The goal is to remain the person you already are, with steady footing, clear head, and the confidence to keep moving through the life you love. Every adjustment we have talked about, from the glass of water on the counter to the medication review at your annual visit, is in service of that one goal: preserving the version of you that walks across the parking lot without thinking, climbs the stairs without counting, and looks up at the sky on an evening walk because the surroundings feel interesting, not threatening. Dizziness after 70 is common, but it is not something you simply have to endure. It is information. It is the body's way of asking for attention, and when that attention is given early, the body usually responds, often more than people expect, and often in ways that restore not just steadiness, but confidence, energy, and the quiet joy of moving through the world on your own terms. Your balance system has carried you through every step of your life so far. With a little informed care, it can carry you through many years more. Listen to it, respond to it, and when something feels off, do not wait. Bring it to someone who can help. Take care of yourself, and stay steady on your feet.